Lisa. We're back. We're going through folliculogenesis. So we're doing the reproductive system in humans. All right, folliculogenesis is the development of the follicle around the developing egg, right? Here it is. There you go, follicle. Primordial follicles are found on the primary oocyte, so early stage, kind of arrested right there in early meiosis, surrounded by a single layer of squamous follicular cells. Follicular cells are connected to the oocyte by a fine, small cytoplasmic process, and that is the process bridge that it's going to use to pass nutrients and chemical signals. It's going to be concentrated in the cortex of the ovary and the outer layer of the ovary. We wait 13 to 50 years before they develop any further, depending on order and stage. The adult ovary has 90 to 95% primordial follicles. Monthly recruitment of about 24 follicles begins a 290-day path to maturity that only one will finish. And, obviously, most of the case, not always, but many times, 23 will die. Primary follicles take about 140 days into the cycle. Recruited primordial or very early stage follicles are going to become the primary follicles, which we are going to focus on developing. They're going to have larger, more developed secondary oocytes, like eggs, in a surrounding layer of these cuboidal follicular cells to support them. Secondary follicles are going to appear around 140 days into that cycle. The oocytes are even larger, and the follicular cells are now in two or more layers. So we are starting to stratify, right, and specialize our layers. Zona pellucida is the closest to the oocyte itself, and it is a layer of glycoprotein gel secreted by the granulosa cells that surround the oocyte. Granulosa, they look like kind of little nuclei all clustered together very close. The theca folliculi is connective tissue around the granulosa cells, and it's going to form a protective layer, like a husk. The secondary follicles appear again about 140 days into the cycle. Oocytes are larger. I'm talking about that. Now, two or more layers of the granulosa cells. Yeah, right. We talked about that. Theca folliculi, the husk, yes. Oh, yeah. The theca interna. So the external part, you could imagine, is going to be on the outer side. It's a fibrous capsule. It's protective, and the thing is, it's like where most of the blood vessels are going to intersect and kind of go in to help support the developing follicle and egg cell. Theca interna is on the inside, right? As you can imagine, the interna, the internal cellular area. And so what this is going to be a more hormone secreting layer. So more cuboidal cells. It's producing androgens, androstenedione, and testosterone. Granulosa cells are going to actually convert those into estradiols. Tertiary, or the third round follicles, are going to appear about 60 days after ovulation. I'm sorry, before ovulation, when the granulosa cells are going to be secreting follicular fluid into teeny tiny small pools or collecting there. As the pools do get bigger, they actually kind of come together and they form this clear structure on the inside, right? And we refer to it as antrium, right? And you can just see it's like a luminous area right in there. Antrial follicles, tertiary and mature follicles altogether in that single antrium, and the periantrial follicles are earlier stages. Columnus euphorius is a mound of granulosa cells on one side of the antrium that covers the oocyte and secures it into the follicular wall, right? So it's like securing it. Corona radiata is the innermost layer of the cells in the cumulus surrounding the zona pellucida and the oocyte as well. And it's basically there just for protection. Mature follicles are just about 20 days out before they ovulate or burst out of the follicle. One follicle becomes dominant, and that's going to be like the one, and that is going to be the egg that ovulates. The rest of them are just going to kind of degenerate. It's going to capture and hold follicle stimulating hormone in about 5 days before it bursts out. During the process of ovulation, it's large enough to be considered a pre-ovulatory or Garfin follicle. Okay, next we'll be talking about the female sexual cycle. And in the meantime, I hope that was helpful. I hope you're out there somewhere having a great day.